Bismillahirrahmanirrahim. Assalamu alaikum. Welcome back my YouTube family. Here we are starting series of infectious disease. This is episode 1, part 1. Before we get started, please subscribe my channel. Look for allergies, culture and sensitivity and medical history. So what we are we will guess, it's a kind of allergy, or we go for a culture sensitivity and a medical history if the patients have regained infection or the previous infection. So this kind of information we require. Assess hydrophilicity vs lipophilicity of the drug for distribution. We also assess this. Dose optimization, time vs concentration dependence. A. Time dependence, suppose dose more frequently, extending infusion time or continuous infusion like beta lactamase, and concentration dependent like dose less frequently, but we will give them higher dose. So minimum inhibitory concentration, lowest concentration to growth or the clear after 24 hours, it is called MIC. If MIC is less than breakpoint, it means the acceptability having with this drug. Breakpoint is beyond acceptable, intermediate or resistant. If breakpoint is beyond susceptible, then it's a intermediate or it's kind of resistance. So you can't use these drugs because there is no use of this drug. Antibiogram provide susceptibility pattern at a specific hospital over a period and used to monitor resistance pattern. Antibiograms aid in selecting empiric treatment. Look for 1% more, look for percentage, increased percentage. So here, gram positive bacteria, thick wall, cell wall होती है उनकी, stained purple and blue. If you are staining them, then it's kind of blue or purple stain they got. So these are cocci, rods and anaerobes. Cocci, Staphylococcus, MRSA, MRSA, MMSA, Streptococcus pneumoniae or Diplococcus pneumoniae. Enterococcus, VRE, vancomycin resistance. Rods, Listeria monocytogenes, anaerobes, Clostridium species, Actinomyces species, Streptococcus species are including in anaerobes. Okay, so here are gram-negative bacteria, thin cell wall, stained pink or red, rods, cocci, coccio, bacilli, anaerobes. In rods, Pseudomonas aeruginosa, Haemophilus influenza, Providentia species, cocci, Neisseria species, cocci, bacilli, Acinetobacter baumannii, Bordetella pertussis, Moraxella catarrhalis. Anaerobes, Bacteriocytes fragilis, Providentia species. In atypical, Chlamydia species, Legionella species, Mycoplasma pneumoniae, Mycobacterium tuberculosis are in atypical types. So let's talk about mechanism of action. Cell wall inhibitors, cell membrane inhibitors, protein synthesis inhibitor, DNA RNA inhibitors, folic acid inhibitors. In cell wall inhibitors, we call them beta-lactam, penicillin, cephalosporin and carbapenems. Monobactam include astronium, vancomycin, telavancin, dalbavancin, oritovancin. So these are including beta cell wall inhibitors. Cell membrane inhibitors, telavancin, टेबेंसिल, डोपेटोमाइसिन, पॉलीमाइक्सिन, कोलिस्टिन मिथाइड, जो कि कोलिस्टिन के नाम से मोस्टली अवेलेबल होती है। प्रोटीन सिंथेसिस इनहिबिटर, माइनोग्लाइकोसाइड, मैक्रोलाइड्स, टेट्रासाइक्लिन, क्लिंडामाइसिन, लाइंजोलेट, टेरिजोलेट, डेल फोप्रिस्टिन, क्यूनोप्रिस्टिन। RNA and DNA inhibitors, FQs, progesterons, rifampin, metronidazole, tinidazole. Folic acid inhibitors include sulfonamides, trimethoprim, dapsone. So these are encountered folic acid. Let's talk about hydrophilic and lipophilic. Hydrophilic, beta-lactam, aminoglycoside, daptomycin, polymyxin, glycopeptides are hydrophilic. Small VD, renally eliminated. Renally is VD, what we call it. So it is a volume distribution, small, renal eliminated, no activity vs intracellular pathogens, poor bioavailability, poor tissue penetration. So if small volume distribution, the poor tissue penetration, renally eliminated mean nephrotoxicity, no intravalvular pathogens, consider loading dose, poor bioavailability, aggressive dose in sepsis. Lipophilic, fluoroquinones, macrolides, rifampicin, linezolid, tetracycline. Large volume distribution, great tissue penetration means hepatic metabolism means hepatotoxicity or DDI. Active vs intracellular pathogens. No dose adjustment in sepsis. Excellent bioavailability mean oral IV ratio 1:1. If you are giving it orally or IV, they both give you equal effect. So let's talk about some drugs, generic and brand. So first we will cover a penicillin. It's a beta-lactamase cell wall inhibitor. Penicillin brand is PenVK, penicillin G benzathine, bicillin LA, amoxicillin, amoxil, moxatag, amoxicillin plus calvinate, augmentin, ampicillin, ampicillin plus sulbactam, onacin, penicillin, tazobactam, noxin, neficillin, oxacillin, D-tacloxacillin. Indication: PenVK first line for strep throat and mild non-purulent skin infection. If no abscess, we will go for a penicillin. Like amoxicillin first line for otitis media, like doc infective endocarditis, and prophylaxis for dental procedure. Augmentin first line for otitis media, sinus infection, decreased dose to decrease diarrhea. Okay. Penicillin G, do not use IV, doc, syphilis. And Tiptazo, active for pseudomonas, is I think piperacillin tazobactam, covers MMSA only, no renal dose adjustment. Very good. Okay. I have studies in hospital. The brand available is like a Tenzo. Zosyn is all. I think these are include the multinational brand. So ADRs, GI upset, diarrhea, rash, PCN allergy. Like penicillin allergies is a serious allergy. We need to take allergy test before we go for a therapy. With the patient, mostly we haven't used. They have a history of allergic symptoms, or they have history of hypersensitivity with cephalosporin, or they haven't taken these kind of drugs. So we need to, we need a more safety for those patients who are using for first time. Seizure with accumulation. Penicillin G, benzathine, cardiorespiratory arrest or death if given IV. So warning. And contraindication: augmentin, unacin, History of cholestatic jaundice, hepatic dysfunction, creatine clearance less than 30. Notes. Covers mouth positive gram anaerobes, chewable tablet available, which form in with moxicillin. Extended infusion more than 4 hours, and cover MMSA. Who cover MMSA? Oxacillin is doxacillin, methicillin, and nicloxacin cover MMSA. Doripanum, Doribex, Meropenem, Marum, Itrapanum, Ibenza, Imipanum, Cholesterol, and Promethazine. Okay, so these are metrolites, and carbapenem IV IM only. Like other beta lactams, they bind to blood protein BP, BPP, blood brain protein, and to inhibit cell wall synthesis are time dependent. Commonly used ESBL producing bacteria, no coverage against atypical BRE MARSA. Stentrophomonas C. differis. There is no activity against them. Diarrhea, rash, and LFT increase. Warning. CNS, seizure, avoiding PCN allergy and penicillin allergy. Do not use DORI in HAP and VAP in hepatic patient. So, notes: no coverage against Pseudomonas, Acinetobacter, Enterococcus must be diluted in normal saline. When I have reading antibiotics, then what I have a difficulty in learning antibiotics, that I forgot which bacteria are acting or producing disease in which part of the body. So for me it is very difficult to remember that if I want to use I have GI upset, so what kind of bacteria in GI is causes this effect, so I have to choose which kind of antibiotics. So if they are telling us that in which bacteria we have to use this kind of antibiotic, but if I'm talking about skin, then what kind of bacteria affected my skin, so then I could estimate, I can suggest or observe then these antibiotic effective for the use. So I will make another slide or another video on it, so it will be easy for me to revise it again. So Astrobacter is azectum, monobactum, okay for beta lactam, PCN allergy. This is okay in penicillin allergy. And areas is like LFTs, increased rash, severe skin rash, nausea, vomiting, and diarrhea. Also, now let's talk about cephalosporin and cefadroxil. Let's talk about first generation first. Cefazolin and cefcabzole, cephalexin, Keflex. These are first generation cephalosporin, cephalexin oral, skin infection, MMSA, strepto, throat, common use. Cefazolin IV surgical prophylaxis, second generation, cefuroxime, Septin, Zinacip, cefotatin, cefoten, cefozitin, Mafoxin, Cefaclor, Saclar, Ceprozil, Cefzil. Second generation, cefuroxime, Septin oral, otitis media, CAP, sinus infection, cefotatin, and cefoxitin IV, Bacilli physalis, surgical prophylaxis. Third generation group, Cefdinir, Omnicef, Thanks for watching. If you like this video, please subscribe, like and share my video. Also mention your any queries related to pharmacy in comment section. Allah Hafiz, until next time.